Welcome to our educational video about Parinaud's oculoglandular syndrome, a fascinating and sometimes perplexing condition affecting the eyes and lymph nodes. In this video, we'll explore what causes it, how it develops, what to look out for, and how it's managed. Parinaud's oculoglandular syndrome, often abbreviated as POS, isn't a disease itself, but rather a collection of signs and symptoms resulting from various infections. The most common culprits are bacteria, particularly Bartonella henselae, the cause of cat scratch disease. Other bacteria like Francisella tularensis tularemia, Sporothrix schenckius sporotrichosis, and even tuberculosis can be responsible. Viruses, fungi, and rarely, parasites can also trigger POS. Essentially, it's the body's response to an infection somewhere near the eye that sets the stage for this syndrome. The pathophysiology of POS is centered around the spread of an infectious agent from the site of entry, often the conjunctiva, the clear membrane covering the white part of the eye, to the regional lymph nodes. Imagine a tiny cut or abrasion on your eye becoming infected. The infectious agent then travels through the lymphatic system, causing inflammation and enlargement of the lymph nodes near the ear or jaw. This inflammation, combined with the eye's reaction to the infection, leads to the characteristic signs of POS. The immune response itself plays a significant role, contributing to the inflammation and tissue damage. While POS can occur in people of all ages, it's most commonly seen in children and young adults. This is largely due to their increased likelihood of interacting with animals, especially cats, who can carry Bartonella henselae. The exact prevalence of POS is difficult to determine, as it's often underreported and can be mistaken for other eye conditions. Outbreaks may occur in areas with high populations of cats or endemic regions for specific infectious agents like Francisella tularensis. The hallmark signs and symptoms of Parinaud's oculoglandular syndrome are fairly distinctive. Patients typically present with conjunctivitis in one eye, characterized by redness, swelling, and discharge. The conjunctiva often develops small, raised bumps or ulcers. A key feature is the presence of swollen and tender lymph nodes near the affected eye, usually in front of the ear or under the jaw. Other symptoms may include fever, fatigue, headache, and general malaise. Vision is usually not significantly affected, but photophobia, or sensitivity to light, can occur. Diagnosing POS relies on a combination of clinical examination and laboratory testing. The doctor will carefully examine the patient's eye and lymph nodes, looking for the characteristic signs. A detailed history, including any recent animal contact or potential exposures to infectious agents, is crucial. Laboratory tests may include blood tests to detect antibodies against specific bacteria, such as Bartonella henselae. Cultures can be taken from the conjunctiva or lymph nodes to identify the causative organism. In some cases, a biopsy of the lymph node may be necessary to confirm the diagnosis and rule out other conditions. Parinaud's oculoglandular syndrome isn't classified into distinct types. The clinical presentation is relatively consistent, although the severity and specific symptoms may vary depending on the underlying cause. Treatment for POS focuses on addressing the underlying infection. If Bartonella henselae is suspected, antibiotics like azithromycin or doxycycline are typically prescribed. For other bacterial infections, appropriate antibiotics are chosen based on the specific organism identified. Viral infections are usually self-limiting and treatment is primarily supportive, focusing on relieving symptoms with warm compresses and artificial tears. In severe cases, corticosteroids may be used to reduce inflammation, but they should be used with caution and under the guidance of an ophthalmologist. In addition to medications, good hygiene practices, such as frequent hand washing, are essential to prevent further spread of the infection. Preventing Parinaud's oculoglandular syndrome involves minimizing exposure to potential sources of infection. If you have cats, especially kittens, be careful to avoid scratches and bites. Wash your hands thoroughly after handling animals. If you're traveling to areas where certain infections are more common, take appropriate precautions, such as wearing insect repellent and avoiding contact with potentially contaminated water or food. The prognosis for Parinaud's oculoglandular syndrome is generally good. With prompt and appropriate treatment, most patients recover fully without any long-term complications. However, in rare cases, if left untreated, the infection can spread to other parts of the body. Recent research is focused on developing more rapid and accurate diagnostic tests for identifying the causative agents of POS, allowing for earlier and more targeted treatment. Studies are also exploring new antibiotic regimens to combat resistant strains of bacteria. Thank you for watching, and we hope you found this video informative. If you have any concerns about your eye health, please consult with a qualified medical professional.